A major shakeup in U.S. vaccine policy this week as the nation's key vaccine advisory panel votes to stop recommending the COVID-19 vaccine for all adults. The Advisory Committee on Immunization Practices, or ACIP, also narrowly rejected a proposal to mandate prescriptions for the vaccine, which for years have been recommended annually, similar to the flu shot. The decision comes after Health Secretary Robert F. Kennedy Jr., a known vaccine skeptic, overhauled the committee earlier this year. In June, he dismissed all 17 members and appointed new panelists, sparking widespread concern among public health experts. During 2 days of deliberations, ACIP debated the COVID-19 vaccine, weighing its benefits for high-risk populations, including adults over 65. In the end, members decided individuals should make their own choice after consulting a healthcare professional. The federal government had already stopped recommending COVID-19 vaccines for healthy pregnant women and children in May.
So this is taken from the CDC website. It explains to people how the mRNA vaccines work, and it tells them that the mRNA and the vaccine clears from the body shortly after vaccination. That's not true. And we heard the lecture, the fascinating presentation from the people in the work group. I want to go back to a culture of safety. One of the things when you think about safety of complex systems or products, if they don't work as intended, that's by itself a safety concern, and you have to actually be very concerned about that, even without knowing what the specific outcomes or consequences of that would be. And we have a range of things on the mRNA platforms that really suggest that it doesn't work as intended. And I think that we all have to consider that when we think about the safety of these products. Vaccination and pregnancy was a highly debated thing among the work group. I think that there were people that felt that we should recommend pregnant women to vaccinate for the reasons that people mentioned here. But most of the people felt that there is strong reason actually not to recommend them. I think that after all, we decided not to bring it to a vote today, but we do hope that the FDA and the CDC will look much more carefully into this, because most of us are extremely concerned about the safety and the lack of robust evidence, both on safety and efficacy for not only pregnant women, but their babies. This is something that I think really deviates from any standards that we knew in the past. Vaccine-specific recommendation, this is something very plausible. We didn't feel that we have time and enough data to make those kind of distinguish recommendations, but I do want to point out two things. There is one study that suggests that the adenovirus vaccines that were part of the initial launch of the vaccines in 2021 actually did reduce all-cause mortality in clinical trials, whereas the mRNA vaccine didn't. And the other thing is that there are also multiple studies that show that Moderna provide higher protection against COVID and lower rate of adverse events. This is again published data from multiple studies from the VA and other places. So I think that going forward, we want to encourage the FDA to really think, and the CDC to really think about more nuanced recommendations, and including considering vaccines that potentially are not currently authorized in the US, because we want to find the best trade-off of risk and benefits for patients. I do want to talk about public trust, because I think it's a critical thing. I don't think that the public currently believes to the narrative of safe and effective. This is kind of a recent poll, and this is just building up on prior polls. And the trust is not just a problem among the public, it's among the people. We saw this slide today, 8% of healthcare workers believe the current recommendation. What does it tell us about our ability to come and continue to forcefully recommend these products when the very same people that are supposed to administer them and recommend them show by their legs?
And in the panel's latest discussions, experts clashed over the evidence. Dr. Robert Malone argued the vaccine did not prevent serious illness, while Dr. Cody Meisner cited clear data showing protection against infection.
There is evidence that in some individuals vaccinated with mRNA vaccines The resulting spike protein, the mRNA, and the nanolipids formulation components persist in different body organs, including lymph nodes and the heart, for a prolonged period of months and possibly years in some patients. Prolonged and persistent exposure to spike mRNA and nanolipid particles is associated with post-vaccine syndrome injuries, as well as potentially other side effects that are currently only partially understood. 6, the safety and the efficacy of COVID-19 vaccines during pregnancy have never been tested in appropriately powered randomized clinical trials. In one randomized clinical trial, there was observed numerical imbalance of higher number of babies with congenital malformations among those born to vaccinated women. Now, I just want to clarify the context here. We are not expecting the CDC to use this specific language, but we really encourage the CDC, both for the vaccine information statement as well as other communication channels, to find the right language to communicate these risks and uncertainties to patients and medical providers, so we can actually have the appropriate informed concerns and discussion of risk and benefits that are realistic to the current knowledge and the current gaps in knowledge that we currently face. The last thing I want to say is to talk a little bit about the guiding principles that we took in order to kind of recommend the specific policy recommendations about who should be vaccinated and what form. Our first assumption was we want to access within the authorized FDA population, especially. Benefits and risk and uncertainty must be communicated as part of informed consent. We debated mostly between individual-based decisions and group recommendations, and I think that the majority of the work group felt strongly, but in a second we'll hear the minority opinion as well. The majority of the group felt that individual-based decision is appropriate, and specifically we feel that these vaccines should now be prescribed as a prescription. And I want to say a few words about why. I think that there are two major reasons why. One is that when you try to quantify the risks and benefits, you very quickly, and we also already saw that in our discussion today, you get to a lot of nuance.
The committee also addressed routine childhood vaccines, including MMRV, measles, mumps, rubella, and varicella. On Thursday, ACIP rejected the combined MMRV shot for children under 4, but on Friday, they endorsed separate vaccines for MMR and varicella, leaving some parents confused, according to the American Medical Association. A vote on hepatitis B vaccines for newborns was delayed. Since taking office, Kennedy has also fired the CDC's chief of vaccines, Susan Monarez, prompting resignations of senior staff.